Hi, everyone. Thank you so much for joining us today at our fifth Catalyzing Communities Learning Collaborative keynote presentation. My name is Julia Pell, and we are thrilled to have Dr. Tashara Leak presenting with us today. Before we dive in, I want to share a few housekeeping items. We will have time for a Q&A after Dr. Leak's presentation, so feel free to post your questions throughout her talk using the Q&A button on the bottom of your Zoom screen. And I've been told specifically by Dr. Leak that you should feel free to ask any questions at all, even ones you might not normally ask in an academic webinar. The Q&A at the end of the webinar will be moderated by Salima Taylor, a PhD candidate in food and nutrition policies and programs here at the Friedman School. Her research explores environmental and sociocultural factors, including racism and discrimination, that undergird dietary behaviors and nutrition health in Black and low-income communities. And through her work, she aims to design and advocate for tailored nutrition and food interventions, communications, and policies for those communities to sustainably reach health equity. We are recording today's presentation and we'll post it on our website. And at the end of the event, there will be a short Qualtrics survey posted in the chat that we hope you'll fill out to give us feedback and help us plan future events. As always, thank you so much for your time and feedback. And now it is my absolute pleasure to introduce Dr. Tashara Leak, Associate Professor in the Division of Nutritional Sciences at Cornell University and Division of General Internal Medicine at Weill Cornell Medicine, and the inaugural Associate Dean of Cornell Human Ecology in New York City. Dr. Leak is a nutrition scientist and registered dietitian who designs, implements, and evaluates culturally inclusive, community-based interventions to address the impact of systemic racism and poverty on food access, diet, and health among underserved and urban communities. She is also the co-founder and co-director of the Action Research Collaborative, Cornell's institutional home for fostering partnerships and cross-sector collaborations among researchers, community organizations, and policymakers to promote equity and generate solutions to pressing societal issues. I am so excited to hear Dr. Leak's presentation today, which is called Fostering Cross-Sector Collaborations Between Community Organizations, Researchers, and Policymakers. This topic is always top of mind given our work here at Catalyzing Communities, and having had the privilege of meeting Dr. Leak and reading her work over the years, I know today's talk will be informative, inspirational, and motivating. So I will turn it over to Dr. Leak. Dr. Leak, welcome to the Learning Collaborative, and thank you so much for joining us. We're thrilled to have you.
Thank you so much, Julie, for such a warm welcome. I am very excited to see you all today about the launch of the Action Research Collaborative. So I'm going to go ahead and share my screen. Yeah. All right. So I'm still figuring out how to give like good webinars because I'm one of those people who really thrive being in person. And so I am going to try to minimize the time in which I am speaking because I think what's most important is for us to have a conversation at the end. But today I'm going to talk about a center that I launched in partnership with a colleague by the name of Neil Lewis Jr. called the Action Research Collaborative. But before I even get there, I'm a storyteller. So I just want to tell you the story of how we even got here. So I'm a professor at Cornell University, as Julie mentioned. And so there are a couple of unique things that have been happening at Cornell the past 5 or so years. So one is that we do not have a school of public health. We've never had a school of public health. And so prior to my joining faculty at Cornell, I was at UC Berkeley School of Public Health. And so there was this like missed opportunity for how do we gather the people who care about public health nutrition, who really care about equity. A lot of us were scattered in various departments, but there wasn't a place for us all to gather. So that was the first challenge that I was met with when I joined the faculty at Cornell was, okay, how do I have access to other folks who really care about equity in really meaningful ways? So that's the first thing. The second thing is that if any of you have ever visited Cornell or know about the geography, Cornell is physically based in Ithaca, New York, which is upstate New York, but our medical school and our tech campus are based in Manhattan. And that's a 4-hour difference away. So when I joined the faculty, we had a new president, President Martha Pollack, who really wanted to figure out how do we get faculty to collaborate across these two entities, across institutions, and we're 4 hours apart from one another. And so they call this like one Cornell, how can we start functioning as one? But there wasn't necessarily infrastructure for that. So there was like desire, and those of us who work in academic spaces understand this story, right? Like there's a lot of desire for something to happen, but then it's like, okay, well, how do we actually do this? So that's the second challenge. And the third was that across the country, if a lot of you have been seeing, especially post the murder of George Floyd, this renewed interest in social justice and how do we diversify the field. There's been a lot of DEI searches, new centers coming about, but that's great. You can diversify your faculty as much as you like, but then how do you actually create an inclusive environment where they feel as though they can belong and that their intellectual thoughts are valued. So those were kind of the things that were brewing. And so I am one of those people, as Gandhi says, be the change. I am a be the change person. So this is really what ARC was created to do, was in response to those three different things happening on campus. And again, a lot of this is happening not just at Cornell, but at universities across the country. So in 2022, it's 2023. In January 2022, myself and a colleague, Dr. Neil Lewis Jr., launched the Action Research Collaborative. And so the goal of ARC is to be the institutional home for cross-campus collaborations and cross-sector collaborations. So let's talk about the cross-campus part first. So in terms of how do we build our campus, bridge the campuses together, Neil oversees all things art that are happening based in Ithaca. I oversee all things art that are based in New York City. So I actually live in New York City and go to Ithaca about a week a month, and Neil does the reverse where he lives in Ithaca and comes down to New York City a week a month. So that's the first thing we did. The second thing is that we realized, and we all know this, especially I'm preaching to the choir here, that we can't keep functioning in our silos, right? And in many ways, sometimes we're awarded for working in our silos. But if we're really going to make some movement to address these various inequities and communities that we care about, we can't have the researchers in one corner, community organizations in another corner, and policymakers working on their own. So we really want to figure out how do we get all these players in the same room together so that we can start working together in meaningful ways to actually move the needle. And so I'm going to, in this talk about some of the partnerships we've built, what our mission statement is. And again, I'm going to leave a lot of time at the end for us to have some conversations. Before we get started, I really want to acknowledge the team of people who made all of this happen. And so again, to the right here is my colleague, Dr. Neil Lewis, who is associate professor in the communications department. We have a postdoc that is based in New York City and in Ithaca. So Zainab Josie, I'm not sure, I think I saw Zainab logged in. Zainab is based in Ithaca, in New York City, and an extraordinary researcher who studies the environment and also like how do we address inequities and climate change and sustainability and nutrition and food insecurity. We have In Young, who's based in Ithaca. And then we also have a research coordinator both in Ithaca and in New York City. So Geneva is based in New York City. Janie is based in Ithaca, and then we have a communication specialist who is based in New York City, but again, serves the larger entity. All of these people are new. We said we launched January 2022. So everything that I'm going to talk about and all of the things I'm incredibly proud that we've accomplished is because of this amazing team that we have. And I did not want to Sometimes we go to these talks and we acknowledge the team at the end, and I want to start by acknowledging the amazing team that we have. So what is the mission of ARC? So our first mission is to build sustainable community engaged projects. And the key word is sustainable. So what we're not interested in is, let me get this 5-year grant, implement the study, and then leave the community. That is not what we're interested in. What is the plan after that grant ends? How do we make sure that the project, the program remains in the community beyond the length of the funding, or at least the initial funding period, and finding new sources of funding? The second mission of ours is to build out an evaluation unit. And this is in response to a lot of us we all have different strengths. And as an academic entity, one of our strengths is intellectually, we have access to resources, both physical resources and also like human resources, to be able to evaluate efforts, where a lot of our amazing community partners are on the ground doing the work with the people, but may not have the time, the bandwidth, or expertise per se to stop and write this grant or evaluate the amazing work that they're doing. So is that something that we can do as an organization? Our third mission is around policy advocacy. So if you watch the news at all, we know that policymakers play a huge role in public health. And so a lot of times, though, the people who are making very big decisions aren't necessarily trained in the areas in which they're making these decisions. So how can we make sure that the science is getting to the right people, that we're at tables and can advocate for various policies? And then the last thing that we're doing is really, how do we support faculty and students? As I mentioned before, Cornell, like many other universities, has reignited their commitment to diversifying the faculty and student body. But what does that actually mean? How do we support faculty who aren't just from diverse backgrounds, but who are doing this action-based work? And I'll give you an example. Like in my department, I'm in a nutrition science department. Most of my colleagues work with mice. So you could just about imagine, like, what does that mean when it's time for me to go up for 30 review, go up for tenure, go up for full professor? How do I communicate my research and my work to people who really work outside of what I do? So let's go ahead and jump into the building sustainable community engaged projects. So one of the things we do is we have an annual symposium. So we had our first symposium last year, and then our second symposium was this summer. And so the goal of this symposium is we meet in New York City at the New York City office, and we're trying to figure out, how do we get who's who in the room to get them to collaborate with one another. So this is an invite-only symposium, which is very rare to see in academic spaces. And we are intentionally inviting people with the thought that if we invite so-and-so, we want them to meet so-and-so. And we have panels on various topics. So this past year, we had a panel on nutrition and health equity, one on development across the life cycle, and another on the social safety net. And when I say the social safety net, under that falls like housing and employment. So we had these 3 different panels. On the panel was someone from different sectors. So there was a researcher, policymaker, and a representative from a community organization on each panel to talk about, well, how do you address nutrition and health equity? Have you worked across sectors? What are things that have gone well? What are challenges that you've experienced? And then after these panels, we have a reception for people to mix and mingle and figure out again, oh, you have this strength. Is there some way we can collaborate? Let's work together. I will go ahead and tell you that even in just our 2 ARC symposiums, they've been incredibly successful. There have been great projects and partnerships that have resulted because of the symposium. So in some of these projects, I'll highlight a little later. So if the symposium happens on a Thursday, the next day we do something that, again, is very outside of the academic norm. We have something called the Day of Partnership. So what we don't want is to continue to work in our academic spaces and think we're going to make change. So the next day after the symposium, we actually go to one of our community partner sites and have a meeting there to figure out, okay, if we were to try to make changes at this site and in this community, how can we partner together? And so in 2022, we hosted our Day of Partnership at the Tree of Life Center. And then this summer, we hosted our Day of Partnership at the Boys and Girls Club of Harlem. And so again, I'll talk about some of the activities happening at these different sites, but for right now, I just want you to know that we have a 2-day event, the first day on a Thursday symposium, and then we're always doing a day of partnership the next day to say, okay, how do we actually make progress and work together on these various activities that we're all very passionate about. So let's talk about the Boys and Girls Club of Harlem. So I started partnering with them in 2021. They are an amazing organization. They have an amazing space and facility. And I'm sure this isn't like many of you have heard of the Boys and Girls Club, at least at the national level, where it's really about how do we support young people becoming leaders in their various communities. So one project that we offer at the Boys and Girls Club, so this is ARC in partnership with the Boys and Girls Club, is something called the Youth Engagement Action for Health Project. And so historically, it has existed probably for the past 10 years. It's a national effort about civic engagement. You know, a lot of youth have a lot of ideas about how to make improvements in their communities, but they're not really given the opportunity to have their voices heard. So in terms of, at the national level, a lot of times it's been focused on promoting physical activity, and it's resulted in new parks being built and things of that nature. So I spoke with the PI of Dr. Misha Boshwe, who's a dean at the University of Minnesota, and she was very much interested in how do we adapt to have an arm focused on food and nutrition. And so in 2021, what we did was we got a group of youth together over the summer, and then there's 12 sessions in the program. The students are learning about civic engagement, nutrition, and then we send them out into the community to conduct ethnographic observations. So what are things that help promote youth to make healthy behaviors, and what are things that are barriers, and then they make proposals about how to make changes in their community. And for those proposals, we're inviting both local businesses, we're inviting local policymakers, so that they're actually maybe like making some nudges towards these changes being made. So this is one example of a project that we have at the Boys and Girls Club. The other thing we've done there is we launched a youth advocacy committee. Again, I want to acknowledge Zainab Josie, and then Natalia Roman and Jasmine Roberts, if they're on the Zoom. They launched this in the spring, and we're continuing it on this fall. But again, this idea that youth have lots of great ideas. So let's, again, continue this training about what does it mean to be civically engaged and make changes in your community. And then the last project that I will highlight is the Contribution Project. So this actually started at Cornell by a colleague by the name of Dr. Tony Burrow. And the Contribution Project, again, is this idea that youth have ideas, but sometimes just not the financial resources. So at Cornell, undergraduate students can apply to be part of the Contribution Project. They get $400, and then they get to make a contribution that is meaningful to them. So in conversations with Dr. Burrow, we were like, this would totally work with high school students. So we wanted to pilot this out at the Boys and Girls Club, and we did so this spring. We gave students $250. They got to decide if they wanted to do a project on their own or form groups to, again, make a contribution to their community. And what that resulted in is there was a group of young men who decided that mental health was something that was really plaguing their peers, and especially among those who identify as male. It's not a conversation in Black males that's not being had. And so they hosted a workshop on the property, and they had a professional come in and talk about mental health. They bought yoga mats that are now housed at the Boys and Girls Club. And then they partnered with another group that said, hey, we also just want to build community with one another. Like, the community doesn't get together sometimes unless something is wrong. And so another group said, hey, if you do your mental health workshop earlier today, let's host a community cookout later after that, so we can just bring members of the community together and fellowship over a meal. Another student identified her prior elementary school. The playground had different paraphernalia and needles, and she was like, we can't have kids going out saying, hey, play outside, but the playgrounds aren't safe. And so she led a cleanup at her former elementary school playground area. And then two groups decided to donate items to local shelters, recognizing that some of their peers actually lived in shelters. And so how do we better support families who are living in shelters? So those are 3 projects happening at the Boys and Girls Club that we are partnered with as ARC. Another partnership we have is with a transitional housing facility that's in Queens, New York. And so what we're doing is, this housing facility is for families that have children. They stay there anywhere from 6 to 12 months. And on the property, you can see here in the bottom right-hand corner, we launched a garden in this space in partnership with our colleagues at Harvest New York, which is a Cornell cooperative extension entity. And then also they receive other social services at this site. So one thing that Dr. Josie is doing is that she's conducting qualitative interviews to examine facilitators and barriers to utilizing these services. So they have people coming in talking about, okay, how do we help you find permanent housing? How do we help you find healthcare providers? What if they need tutoring for their kids? But for example, what if the people coming in only speak English, but several of the residents speak Spanish? What if the residents aren't aware of these services? Or what if they've had negative experiences? What if there are additional services that they are interested in? So this is really important work to think about, like place-based programming that can happen for families in transition. The other thing we did, for those of you who are familiar with cooperative extension, is the Expanded Food and Nutrition Education Program is the largest federally funded nutrition education program in the country. And it has it's usually like an 8-week program. So what we did was we adapted that 8-week FNET program for families in transitional housing and added a gardening component. So it looks like if families meet 2 hours once a week for 8 weeks, they have that 2-week class, and then the expectation is that they support the garden in the backyard once a week. And the idea around the garden is that, one, is something beautiful and aesthetic. Also, for those of you who study like the IKEA effect, this idea that if you build something, you have a lot of pride in it. And then once they move out, the goal is that they get to take one of these plants with them as like a housewarming gift as they transition to their new home. So these are the projects we have at transitional housing residents. Another partner we have is the Field and Fork Network. And ARC is servicing the entire state. While our offices are based in Ithaca and New York City, we are trying to, especially as the land grant university that Cornell is, we want to support efforts in the entire state. So we partner with a nonprofit called Field and Fork Network, and together we have GusNet funding to implement the Double Up Food program. Those of you who aren't aware of that federally funded program, for every $1 spent on fruits and vegetables, SNAP benefits, they get $1 to spend on fruits and vegetables on a future purchase. And so where ARC comes in is thinking about, okay, right now this program is currently offered in 33 states and 33 counties in New York State. How do we expand that to more counties? How do we make sure, if equity is the goal, do we have enough grocery stores, farmers markets participating in the Double Up program in Black communities, for example? So that, again, we're addressing the inequities within the inequities. And so we've been very successful with getting GusNet funding. We also have some New York State funds to implement this. We're also trying to figure out, what about the use of technology? You know, more and more people are starting to grocery shop online. Can we implement this program with SNAP families receiving SNAP benefits online? What about at the grocery store line? Right now, people have to sign up for this program on paper. So you could just about imagine you're checking out, you got a cashier asking, hey, do you want to be part of this Double Up program? Then you got to stop and fill out a form. It's a lot of work for both clients and the folks who are working at the grocery store. So one thing we're going to test out is, if you swipe your EBT card, what if you're just automatically enrolled in the program and there's no additional paperwork? So these are the type of things we're trying to figure out. How do we get more people to participate in the Double Up and also use those benefits? And then lastly, I'll highlight partnerships we have with our Department of Health and Mental Hygiene to advance various equity-related projects. There's a brand new office out of the health department called the Office of Housing and Health, and they have formed a task force to figure out, in our Section 8 housing in New York City, how can we offer, again, more place-based programs. So if we were to offer mental health services in our NYCHA properties, which again is our public housing in New York City, which is the largest number of public housing in any city in the country, what would that look like? What would it look like to support families where they live to improve their mental health? And so we're, again, at the table for those conversations. And then lastly, I said lastly last time, this is actually the last partnership I'll mention, is the Tree of Life Center. And so this is based in Queens, New York. Church, First Presbyterian Church has a foundation. That foundation has a center, the Tree of Life Center. And they actually just built affordable housing. So how amazing is that to have affordable housing in Queens, brand new apartments, like premier apartments. And then on the bottom, on the first floor, there's a clinic. So like there's pediatrics, dentistry, and other healthcare services all in the same building. And Cooperative Extension also has office spaces there to offer FNEP classes. They also have a gymnasium next door where they can offer different programming for youth. And so ARC is trying to figure out, this is an amazing partnership that Cooperative Extension already has a Tree of Life Center. We hosted our first day of partnership at this site in 2022. What are ways that we can continue this partnership, especially because we have residents who live here? So now there's conversations about, can we have childcare offered at this site? There's already a pantry here. Can we expand the pantry? There's already in the process of figuring out, how do we support seniors? What about intergenerational programming? Can we get the youth engaging with the seniors? And so this is a really exciting partner that I'm really optimistic that there's really amazing things that we can do together. So I'm going to take a step back for a second. I just highlighted very specific things we're doing in very specific places, but what you should know is that what our goal is that we want to have like a partner in each of the boroughs in New York City, and so that multiple people, multiple faculty can work with partnership. So what you're not see, if I gave this talk 5 or 10 years from now, it will be the same partners listed with the addition of maybe 1 or 2 more. We want to put all of our efforts into like a very few number of places, because again, this whole idea of you get a grant, you go in, you go out, we want to stop that. Also, we recognize sometimes the project you're working on may just simply end, but since we have ARC faculty affiliates, the idea is that multiple faculty can be engaging with these spaces. So I'll even say, like, tomorrow I'm going to the Boys and Girls Club. They're doing a lot of Halloween events. My team, we're all going to support those events. So we want to be integrated in these various community organizations. We don't want to be viewed as outsiders. We really want this to feel like we are in partnership together. We're showing up when you're having events that have nothing to do with research, that have nothing to do with the project specifically, but it's just like, how do we support the place and the people? And so again, our goal is just to have like 1, 2 partners max per each borough in New York City. And we're thinking about how we can be with them for the next 10 plus years, not just for the next year or next 2 years. So that is our community engaged projects. I will briefly go over some of our other deliverables. So again, we have an evaluation unit, and we are talking about from start to finish, we can offer services, and we do this on a sliding scale. For very small organizations that don't have a budget or at all, like, we're able to offer some services for free. And then for larger nonprofits who have very large budgets, again, they pay a larger fee that is equitable. And so we are able to help everything from like the conceptualization of an idea, to helping with grant writing, to helping with collecting data, analyzing data, writing reports, and also other ways to disseminate. Again, we have an amazing communication specialist, Natalia, and she has really been great about storytelling, right? There's lots of ways to tell stories. A lot of folks aren't reading those very long manuscripts we're writing as scientists, but instead they're reading, again, beautiful infographics. If we have to do radio or television or write an op-ed for the New York Times, like, we are prepared to do all of these things. The reason in which we're able to do this is that we did receive some funding from the New York State budget to launch our evaluation unit, which was really amazing to us. We got this funding on our first attempt, because the state gives a lot of organizations money to do really great work, but the state is also questioning, okay, how do we know that these programs are being impactful? How do we know if we might need to amend these programs? And so they saw ARC as an opportunity to support an organization to help with evaluation needs for organizations across the state. And so, you know, we have ARC faculty affiliates with lots of different expertise, and I'll talk about those faculty affiliates later, but who contribute to this, not just the team that you saw earlier. in terms of policy and advocacy work, again, we're there. So for the first time ever in 2022, I lobbied. When I earned my PhD, I never thought that I would be engaging with policymakers. I never thought that I would be lobbying. I had to learn, like, what does this mean? Like, how do you lobby? I'm used to being a long-winded academic, right? We write, the longer the better, it seems sometimes. And here it's like, no, you got 30 seconds to get someone's attention. You got to create a one-pager. How do I frame it in a way that's digestible for someone who's making policy changes? So I've also been learning along the way a lot of amazing new skills. So in this picture in the upper right-hand corner, this is myself and Neil Lewis meeting with our Lieutenant Governor to talk about equity and the priorities for the state and how art can support state-level initiatives. In the bottom right-hand corner, you see Dr. Jamila Mishner, who is at a White House event talking about her work, and she does a lot of work around like Medicaid and housing. Also, who's an art faculty affiliate, a name some of you might recognize in the nutrition world, is Dr. Angela Odom-Jung. She's a faculty member and in the nutrition department and also an art affiliate. She was involved in the White House convening that occurred last fall. And so again, we're able to provide training opportunities to our art faculty affiliates and art graduate students on how to show up in these spaces, because what we don't want is our research living in a little bubble. How do we translate that into something? How do we work in collaboration with policymakers? And the last thing I will highlight are the amazing faculty and students. So again, like many other universities, Cornell had a social justice cohort hire in the College of Human Ecology in 2020. And then the rest of the colleges followed suit in the following years. That resulted again in like a large number of faculty who demographically look different than historically what the faculty looked like at Cornell, and also who are doing work that is maybe different than what we have traditionally done at Cornell. And so again, we don't want to have, it's great that we have great recruitment, but retention is really where we can applaud ourselves if we are successful at retaining faculty and for faculty to feel like I have an intellectual home here. So what that looks like for faculty in between the College of Human Ecology and Ag and Life Sciences, and also our new Brooks School of Public Policy, we host monthly works in progress meetings, we host writing retreats, we offer a lot of professional development and mentorship, and we also have like social gatherings. Again, Ithaca is very isolated. And so building community and for people to feel like, oh, not just on campus, but also like I have a life outside of campus is really important. And so it's been a pleasure to work with the art faculty affiliates. We have, I believe, about 20 faculty affiliates at this time. And again, we just launched January 2022. The other thing I want to mention here, because I know these type of searches have been happening at multiple institutions, I'm sure Tufts has had something similar, is that how do we also change the culture in various departments, right? And so if you use mixed methods to conduct your community-based research, your community-based, equity-based research, well, how do we have conversations with senior faculty who are voting on cases? And so if issues arrive in various departments, those issues are reported to myself and Dr. Lewis. We're able to have conversations with our deans, who then can create policy change for various departments around how are we evaluating research? How are we also acknowledging that community-based work, and to do equity work in a good way in partnership with communities, not in a hierarchical way, it takes time to do that. So how do we start shifting the culture to support action-based work that advances equity? And so again, like there's a lot of faculty who are interested in this, but how do we start changing the narrative, what these academic institutions can do? And along the same lines, we have a very diverse student body who really cares about how do we actually use science and use research to do something real, to do something meaningful. And so the same thing, we have monthly works in progress meetings, writing groups, social outings, and then we also host a summer fellowship where we take 2 graduate students. They're able to apply for our summer fellowship. They come to New York City for the summer. They help with our various projects. They work on like a chapter from their dissertation and get feedback. We are looking at cover letters and CVs and talking about, okay, post-graduation, what do you want to do? So we, again, just offer a lot of amazing support to 2 fellows every summer as part of the ARC fellowship. So again, just January 2022 that we launched, and we have been very very productive, very successful. Again, because we have an amazing team of people, and also because I think we really are addressing a need that has existed for a long amount of time. Some of our successes have included, again, new partnerships with organizations we haven't worked with before. We've been successful at getting different types of funding. So we have funding from foundations, we have federal funding, we have some internal funding. We're also fundraising with alumni. And in the past 18 months, is it 18 months now? Maybe a little more than 18 months, we have secured about $10 million in funding since January 2022, which is unheard of. We've grown faster than what we've anticipated, which is a good thing, but it's also like we're constantly, it seems like every 6 months we're having to restructure to grow and really respond to the need. And again, I think what people are excited about is that, hey, we actually want to do something, right? Like we actually want this science to live beyond this paper. Like we want to be in partnership with communities. We want to be at the table. And so there's a lot of excitement, a lot of people who want to be part of ARC, and a lot of organizations that especially want to take advantage of our services throughout our evaluation unit. So we're just constantly trying to figure out, how do we grow the evaluation unit? How do we make sure we have enough hiring, that we're constantly hiring program evaluators? How do we train students maybe to help with some of our evaluation needs? Can we count that as course credit? So we are constantly evolving and growing, which is a very good problem to have. The other thing we're thinking about, again, the Tree of Life Center is extraordinary. The fact that public housing has opened, the ribbon cutting was last December, families have been moving in nonstop. How do we do more at the Tree of Life Center? Because I think there's a model there. If we can figure this out, I think place-based programming is where we really need to be heading, especially if we're talking about supporting families that have low or no wages, who have access to few or limited resources. How do we meet people where they are and offer all kinds of services there? In wealthier communities, this happens, right? This whole idea of eat, work, live, play. I'm sure in downtown Boston and New York City, you see the high rises, and at the bottom, there's a Starbucks and a Target and a Trader Joe's. Well, how do we create that also, that whole idea for families who are not wealthy and families who are financially struggling? How do we create that dignity and also, again, just providing resources in a way that's very convenient? And then, as you saw, we have partnerships in Queens and we have partnerships in Manhattan and Harlem. So now we're trying to think about, okay, we need to start building out a partnership maybe in Brooklyn, but timing is important because we want to make sure our existing partners are solid and we have a plan before we add on another partner. So we're thinking maybe adding like one partner a year or every other year until we have a site in each of the 5 boroughs. But again, we want to be very, very thoughtful about how we do that. So with that, I will end. Again, here I'm just acknowledging some of our amazing partners and then also some of our funding that we've received. So I'll stop sharing my screen. Please follow us on Twitter and on LinkedIn. We're a new organization, and so people are still learning about us. So we appreciate any of, if you're able to follow us on any of our social media platforms. So thank you so much.
Thank you, Dr. Leak, for that wonderful presentation. We had a comment that's essentially saying, you're doing such great work in the community. So thank you for engaging the youth, especially in the programs that you highlighted initially. We're waiting for more questions, everybody. So feel free to put them into the chat. Another participant asks, does ARC currently offer any remote programs? Do you have programs non-Cornell students can participate in?
Yes. So right now we are not offering any programming remotely, though we are open to whatever our partners and the people say, right? Like, so we try to just be very responsive. So if someone said, hey, we want to have a remote program at the Boys and Girls Club, we'll be totally open to that. I think what's happened, especially remembering like New York City was in the epicenter of the pandemic, right? And so people are zoomed out. So we had in my research, not in ARC, but in my research, I had some like telehealth virtual programming that now people are like, we don't want to do anything else on Zoom. Like we want to have in-person interactions. And so no, we don't have anything virtual right now. Everything's in person, but we are open to that. In terms of partnering, you know, we actually get this question a lot, not about do they have to be Cornell, but one of the things we think about is that like pay equity. What does it mean for us to say like equity, 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 and then like we don't practice what we preach? And so we only have people that we don't accept volunteers. So if we can't pay you and pay you equitably, we won't have you work with us. The other thing we worry about too is that these communities have been like gutted, especially during the pandemic. And so trust is super important, and especially talking about the historical relationship between colleges like Cornell University and said communities where it's been very extractive. And so what we want to do is make sure whoever we have on our team, like we're there on a regular basis. So we don't want people popping in and out. So that's why we're showing up to the Halloween event. Like you all, we don't need to be at the Halloween event, right? But we're going because like it's our partner. Like these are our people. Like these are people we go and have dinner with. And so we show up for these things. And that's why it's a little harder to do that on like a volunteer basis.
Great, thank you. Anne Maria Medina asks, is ARC part of Cornell and therefore not limited in activities that could be considered lobbying?
Yeah, absolutely. So we are part of Cornell University. We are housed within the College of Human Ecology and College of Ag and Life Sciences. Our primary college is CHE, the one that I'm housed in. So in terms of the lobbying, there's so many rules, but yes, we are allowed to lobby, but like we have to do all these trainings, we have to document it. And there's certain things we can and can't say. So yes, we can, but there are a lot of rules that I'm still learning. And they have a great group of people there to help us facilitate. So never am I lobbying on my own. Like people are ushering us through that process.
Great. So I think we have a few questions that are along the same sort of interest. One of them is, I was wondering if you have collaborated with other similar programs who may be interested in starting projects similar to ARC in their local communities. And then we have another question about how do you get connected to communities or expand your community, and how long does it take to create that connection and that partnership? So yeah, how is that done? And then how would you recommend it with those in other places?
Yeah, so I'm gonna respond and then totally circle back to me if I didn't answer one of the questions. So in terms of how we form these partnerships, it's usually always through another person. Again, I just want us to pause for a second and acknowledge like the trauma, right? And let's acknowledge like the history of how many communities have just been treated. And so I do not take for granted anytime someone welcomes me into a space. And while I identify as a Black woman, it's been something I've had to reconcile around how am I a Black woman who is a scientist and a professor in spaces where the first thing people see about me is that I'm with Cornell, not that I'm a Black woman. And so I've had to really figure out how to reconcile that. And so one of the things in terms of how I built relationships with community organizations is that I always have someone who's the in-between. I'm never emailing an organization, like I'm not cold calling. I'm like, okay, who do I know who knows someone? And I try to make it as organic as possible. So like for the Tree of Life Center, for example, Cornell Cooperative Extension in New York City has been partnering with them for more than a decade. I am meeting with Cornell Cooperative Extension folks regularly. We have other projects together. So they invited me and us into that space. And again, in the beginning, it wasn't an ask. Like I was just showing up, volunteering. I was just showing up and listening. And then it was like, oh, what about this? And then we had, again, organic conversations. Boys and Girls Club of Harlem, I had an employee who was like, have you ever considered working with them? And I was like, hey, I didn't even know they existed. Like, and they were like, I want to connect the two of you. So it's been a lot of that versus me saying, I have an idea, let me Google an organization and reach out to them. So that's how we foster that. In terms of the time it takes, it really varies, right? Like sometimes I'm actually able to move things very fast. I think things happen that transitional housing that happened very fast, but that was because like that organization was ready to go. Like, again, we had a mutual contact who was like, let me bring all of you all together. And I was like, what are your ideas? And then we went back and forth and they were like, let's go. And I was like, okay, you're ready to go. And I was able to go after funding immediately. And so I think that partnership just started. Our first meeting might have been last December. And already since then, we've already been, again, Zainab's been doing these interviews. We've done 2 waves of that 8-week adapted FNEP class. And we just met for the first time last December. So it really varies a lot. Oh, go ahead.
No, you go on, please.
Yeah, I was just going to say the other thing I always also try to do is ask, like, what else do you need? Like, forget the things we work on together. Are there just random things that I can support you on? And so like the garden, for example, like their lead program coordinator, I may not have her title right, but she's just extraordinary human being. She was like, I've been wanting a garden here for years. So we weren't thinking garden, right? Like, but she was like, this is the thing I wanted. So then we were like, it's done. So then we made calls and we got soil. I don't know anything about that. Harvest New York, I do not have a green thumb, right? The same, like Boys and Girls Club, sometimes they're just like, we just need a couple of people to show up for this event. We want to host a career panel. Can anybody in your team show up? And we're just like, yes, absolutely. We'll figure it out. So like sometimes it's also just showing up for your partners, and even if it has nothing to do with the thing that you're working on together.
Yes, thank you. And I think that's a wonderful reminder, especially for academics, to get out and really see what's going on in the communities that we sort of espouse to be interested in working in or concerned about. And so thank you for highlighting that. There's another question. How do you think graduate students working in action research internationally can be supported through the center?
Yeah, so we are very much dedicated right now to New York State. So is this about, yeah, so our efforts are all about New York State. And again, a lot of that is to honor like the funding that we received where it was like, it was spelled out in that way. Now, I don't know if the question is, if you are not a citizen, can you work on, like, if you're not a citizen, we have people who aren't US citizens working with the ARC, if that was the question. So like, you don't have to be a US citizen to work with ARC. If we have an open position, we take, again, just amazing human beings who really care about the issues. But in terms of all of our projects and our efforts right now, they are very much centered on New York State, and I will say policy at the national level. So if someone said, hey, do you want to work on a project in Texas together? We probably wouldn't do a very specific project right now, just because, as I said, we've been very successful and we still have a small team. And so what we don't want to do is add on something that we can't do well. And this also goes to your earlier comment about like, we're being so thoughtful about how fast we grow and how many partners we have, because the relationships are just really, really important. And we can't be in 80 million places at once. And so we're really going for depth versus breadth. But again, from a policy standpoint, we're 100% showing up for things at the national level.
Wonderful. So we have a couple of questions essentially asking about how do you measure impact, and how do you, in co-designing these programs, consider sustainability?
Yeah, really great questions. So because we have a large number of faculty affiliates and postdocs with different training, so like I'm trained as a nutrition scientist, Neil communications and psychology. We got some people who study human-centered design. Like we have a really diverse group of people from like how we're trained. We have a lot of tools in the toolkit. So all of that is just on a case-by-case basis, right? If one of our partners says like, we're trying to figure out how many people are actually using the double up programs, then we can propose the appropriate methods. So it's hard to answer that question, but I think the short answer is that we don't come in with ideas. Like we come in just trying to understand what is the problem, what is your question, and then we propose appropriate methods. So we do everything from GIS mapping, focus groups, interviews, surveys, diet recalls, diet records. Like it's pretty vast what we're capable of doing. From the co-creating space, what's interesting to me is that I think people I've heard colleagues from all over the country say, oh my gosh, I have such a hard time sometimes with like my partners, and like there's this control fight. We don't have those problems, but I think we don't have those problems because people don't question our intentions. And so we know like this is our role at the table. Like we can help you with the science and research, but like this is your organization and also like your community. And so I feel like when we're sitting at this big table, everybody knows what their role is. So we don't have problems with co-designing. Like, again, we have a partner that might say, we know that we don't want to do yoga, but like mindfulness is okay, because when we talk about that, no one cares about yoga, but we care about mindfulness. I'm not coming in saying mindfulness is great. The literature says this, this, and this. I'm saying, okay, that's what the people want. That makes sense. Okay. What do you need from us? You want us to design an intervention that incorporates mindfulness. Let us get back to you. And then we're giving them ideas and this back and forth. So we are 100% co-creating, but a lot of our partners are trusting us to come with ideas, especially around like evaluation. And we are trusting that they understand like the people and understand like what the people want and what the people don't want.
Right.
And then in terms of the sustainability, we think about that from the start, right? Like it's not an afterthought. So even if I get a big federal grant, I'm like, okay, how many times can I reapply for that federal grant? If only once, what are the different ways in which we can get funding? Why is this project so expensive? Is there a way to cut the cost? And then ultimately, whatever the thing is that we create, it's left at the community. I don't need to own anything. When I go on to Glory and y'all are talking about me, I should own absolutely nothing of these projects. Like they need to be housed with the people. And so we are constantly thinking about, okay, my team is going to implement right now because we want to make sure it's evidence-based, but at some point it should be your staff that's implementing that. Again, what is the funding mechanism? How much does this really cost? If we do have to scale back because of money, how can we do that and do that well? All of this is not going to be perfect. There might be a gap in funding. We might completely lose funding. But again, I think what no one's ever doing is questioning our intentions.
Thank you for that. And I think a slight follow-up, and I think the answer to this question is yes, but it is, do community partners participate in deciding research questions and other pieces of the research projects, not just day-to-day tasks?
No, 100%, 100%. And then also because sometimes our partners have to report something specific. So I'll give Field and Fork as an example. Like there are things that they have to report annually, that are just like what they have to report. And so I'm like, no problem, we can collect that too. And then I'll also say things like, hey, but also I want to make sure that if the goal here is equity, how do we make sure that there are enough grocery stores in predominantly Black communities? And they're like, yeah, how can you think about that? And then I give suggestions and I'm like, we can do X, Y, and Z. This is how we can evaluate it. And then they're open. So absolutely, like whatever the evaluation needs are, and oftentimes they are different. And let's say we do have like a graduate student or a postdoc that has their own questions. I don't think because we've already built relationships, it doesn't feel weird to talk about it. Like I think by the time we're saying, oh, and this postdoc is also curious about this, this, and this, we've already thought about, is their question mutually beneficial? Does it help advance the organization's mission and needs? And then at this point, the organization already cares about the postdoc as a human. So they're like, oh no, we got to get them a job. Yeah, you could ask that question. That makes sense. Or like, so like, it's just, I think the thing that is hard to articulate and I'm trying to say is that we have relationships.
Yeah.
Right.
Yes.
Like,
yeah,
it doesn't feel so like, when I go into these spaces, I'm not wearing 3-piece suits, right? Like I'm not Dr. Leak, I'm just Tashara, unless it's the kids. The kids, we have like some cultural norms around respect, right? But like, we're in relationships, so it just doesn't feel odd. And then when things do arise, because nothing is perfect, we're able to talk through things because we're not questioning who we are and our intentions in this space. So we've definitely had situations where like the university, for example, wanted to write a story and they send me a draft of the article and it's all about the Cornell researchers and not centering the partners at all and didn't quote the partners. And so then the partners are like, what is this? We're the ones who actually did all the work. Like, yeah, you helped us get the money. And I'm like, nope, I'm with you. I already caught this. And then that's what I mean by like Neil and I are now positioned to be in the ears and make some systems level changes, even around storytelling out of our communications office. And it's like, anytime you see our names, you've got to get a quote from the organization. We also are talking about the order in which you talk about people and who's doing what, so that everybody's getting acknowledged. So we're going to run into challenges, but because of the relationships, we've been able to work through anything that's come up.
Okay, rapid fire. Who eats the food grown in the gardens?
The people who live at the facility.
Okay, and how do you get the campus faculty and staff to know about extension so that more campuses and extensions work can occur?
That is
Maybe
way
not
longer
so
than
rapid.
a minute. Yeah, that is a longer question.
Yeah.
I think the people in the faculty affiliated with ARC collaborate with Extension very well, and we also have the director, the ED of New York City Extension is part of ARC, is an ARC.
Okay, there you go. So plugging in people who are the leadership.
Yes.
And then I'm sorry if anybody's question wasn't answered. The last question by Whitney Dowds was, are there unique social media campaigns or new technologies you've used to share your data and your organization's projects with supervisors and the community?
Yeah, so I think that is where we are next, because again, we just launched January 22. So a lot of our storytelling has been like around like the launch of ARC and launch of partners. And so we're now starting to think about, well, how do we tell the stories of like, okay, we did X, Y, and Z. So the short answer is that we're still figuring out that. But again, we have a great communications expert on our team and connected to communications expert, broader community, just to figure out unique ways to storytell. But we're excited about it.
Yes. So with that, I would like to thank Dr. Leak for this amazing presentation and work. I would say if you have additional questions, reach out to her, but you know what? She's on sabbatical. So, maybe perusing the website, maybe.
And we have ARC has an email address. So like,
Yes.
Even if it's not me, like someone from our team can respond. So please, I think this is posted and it was on the last slide, and I think those are going to be shared. Please send an email out to the ARC email. So, and follow on social media.
Yes, thank you. So I would like to encourage everybody to click on the link to provide feedback for the event. And I wanted to thank all of the participants for your passion to this work and your interest in this topic. And again, thank you, Dr. Leak, for taking the time. And we'll see everybody next time.
Thank you all so much. Thank you. Have a great rest of your day.
You too.
All right,
bye-bye.